Would you know how to respond on the NCLEX if your client getting tube feeds starts to aspirate? Well, in this question, we've got this client getting tube feedings and they start vomiting, and we need to figure out which action should we take first. And on the NCLEX, whenever they ask you what action to take first, you always want to pick the quickest action that's going to address the problem and keep the client safe. And so in this case, the reason that vomiting is dangerous for this client is because they are at risk for aspiration. So we need to quickly intervene to prevent them aspirating because they could develop pneumonia and respiratory failure. So for this client, we need to do all of these things. We need to stop the tube feeding, provide oral suctioning, position the client sideline, and notify the healthcare provider. But which one do we need to take first? And remember, if the problem is that they are aspirating tube feeds, we need to stop them vomiting, secure the airway, and then make sure they're stable. So if the thing that they're aspirating is the tube feeds, we really should be stopping the tube feeds first. This is going to prevent more tube feeds from infusing and potentially going into their lungs. We don't know if this tube is malpositioned or what's going on. So we just need to stop the tube feeds. Then we can clear their airway by placing them in a sideline position and suctioning their mouth as needed. Then you should assess this client, count their respirations, measure their pulse oximetry, and contact the healthcare provider and let them know what happened. They might want to get a chest x-ray or hold the tube feedings for a certain amount of time to keep this from happening again. So remember, on the NCLEX, you want to stop infusion of any tube feeds or drugs that are causing a problem first. And we're correct. Great job.